Joining us now is Professor Kenneth Yongabi, a professor of public health, infectiology, and phyto-biotechnology at the Imo State University in Owerri, and is also a director at the STK Biotech herbal company in Nigeria. Very warm welcome to Newsnight. Now, tell us, what is really delaying Nigeria's foray into manufacturing these vaccines, whether the herbal derivative, as we have a lot of fauna world in Nigeria?
Well, thank you very much for bringing me onto this platform. I think maybe I would recoin your question to say what is delaying Africa.
Okay, expanding it.
Yeah, it's going to be unfair to say what is delaying Nigeria.
We're the giants of Africa. If Nigeria gets it right, Africa gets it
well, we're already seeing some countries really,
if you look at Africa, Africa is, politically 54 member states. And if they congregate together, and the question again is put, what is delaying Africa from solving their own problems? Let's not look at the Europeans as well. Let's not look at the Americans, but what is delaying Africans from solving their problems? I think, I don't want to speak like a politician, but I would like to address that as a scientist. The science is there in Africa. The herbs that you are talking about, the capacity, the scientific expertise and the scientific capacity is there in Africa. I mean, if you go to Europe, you go to America, in any of these continents, you see African scientists excelling very well and contributing to these nations in terms of hardcore science. They are there. But back in Africa, of course, back in Nigeria, now that's your question and that's your worry. Why are we where we are? I think we need to expedite the political will. We need to expedite the political will. And that holds true across Africa, not only Nigeria. The question is, Nigerians, if you look at the Nigerian institutes, the universities, the professors, and the scientists across the country has tremendous capacity.
Having
be able to take the country and the continent forward. But we need to sit down and have science policy dialogue. We've reached a situation where we're not communicating. Governments in Africa, and I say Africa, and I want to really speak clearly about Africa, they need to communicate carefully with the science, with the scientists and the expertise to come together, to harmonize their thought and move forward. I mean, to be fair enough, let me not be too brutal to castigate governments. No, I think there is that kind of dialogue going on in silo, in different capacity, but we need to expedite that dialogue and activate this policy. The policies are there. I mean, to be fair to government and to be fair to the scientists have the expertise, the government have really the power, and they've been trying to, ever since the history of COVID and ever since we had COVID, they've been trying to do something. But the issue is, how expedient are we in doing what we are doing?
That is the germane question right there, because if you look at it, we've seen countries, come up with 1, 2, 3 vaccine candidates, whereas Nigeria, we've not even seen any. Countries like Madagascar, for instance, even though they came up with some sort of solution, it was their own solution until eventually, their theory was actually disregarded at the end of the day. But they came up with a homegrown solution. So what are the challenges inhibiting Nigeria? You keep talking about Africa, but I'm concerned about Nigeria here, because I know some countries on the continent have actually gone further than we have. What are the issues inhibiting us from actually finding homegrown solutions, even far above even COVID, just health challenges that are endemic in the country?
Well, again, thank you for your very important question. I keep speaking about Africa because I'm coordinating an Afrocentric working group at the level of the African Union, Scientific Council, which is made up of 12,000 scientists on the database and cuts across the 54 member states of Africa. So probably that's why you see me keep going to talking about Africa, not just Nigeria, because I'm coordinating that particular group at the level of the African Union. Now, you mentioned Madagascar. Let me take my barometer from there. Again, you see the dichotomy between politicians, and scientists. The Madagascan situation and the president had a very good intention to be able to proclaim the sovereignty, the scientific sovereignty and the political sovereignty of that country. Yeah, he came up with something, but he hurriedly did that. That's the first error he did. He had good intention, but he hurriedly did that. He needed to be able to sit down, concert with the science, and let it be even the scientists, he would have actually presented a scientific thesis so far as that is concerned, and then bring in the policy issue. So he hurriedly did that. And of course, you are aware that Nigeria actually took samples of that and analyzed, and they didn't come out with, a corroborative results, as per the claim that the Madagascan president gave. Yeah, but we salute that intention. We salute the courage that he came up with, but he hurriedly did that. That also shows that there wasn't a clear dialogue between him, the politician, and the scientific expertise. That is very, very critical. Well, now, let me just quickly run up this by saying that we have what it takes, as I've said already. But again, we haven't harmonized all what we have. And there is. It's so fragmented. We haven't harmonized that. And then to act. One thing about Africa is that Africa doesn't seem to have that courage at the international level to say this is Afrocentric approach that we want to go. Africa doesn't have that courage.
All right, Professor Kenneth
Yongabi, thank you for joining us tonight.
It's my pleasure. Thank you very much.